Inner Voice, a heartfelt chat with Dr. Foojan.
It's so joyous, actually, to have you, Dr. Diane Mueller. Welcome to the show.
Oh, thank you, Dr. Foojan. It's awesome to be here. I'm excited for our conversation today.
I love it. Your background says my libido doc. So I guess we're going to be talking about libidos because it's one of the most not only interesting, but probably most important factor in someone's life. People really, as you know, I've been a therapist for about 30 years, and couples therapist. So obviously, the conversation of libido, the mismatch of the libido, and then across the age, as we're aging, what happens to our libido becomes one of the center stages of not only who we are with our own bodies and identity, and do we see ourselves as attractive or not, or motivation, but also in our relationships. So first of all, what got you interested in this arena?
Several things. I have a couple stories to tell. And the first story is really around what got me interested in just studying sex to begin with. And the second story is more around, hey, when did I actually decide I wanted to bring this into more of a career, like helping the public with this? So I'll tell you the first story first, because I think it's super pertinent in the regards of understanding how sex and how this conversation is so much more than a lot of people just like think of. Because, a lot of times when we think about sex, it's so easy to just like get into this frame of, well, I know I need to do this for the health of my relationship. But there's so much research around not just the health of the relationship, but around sex and actually the health of the individual. And I think it's important because sometimes when we're like not in the mood and there's the desire mismatch, it's important to understand everything that comes from it, because I find that when we know kind of some of the why and the what, it motivates us to say, okay, I am going to prioritize this. So one of my early stories was from my early 20s. And at this point in my life, I really was extremely closed as far as not only my experience, but also as far as talking about sex. Like it was just very, very taboo. I grew up really religious. And while I still love and appreciate all the different ways people have practiced spirituality, the way I interpreted spirituality and religion, with the way it was explained to me, I had a lot of shame around my own sexuality. And I certainly had never explored the world of self-pleasure. So this is really important in this conversation because I started experiencing, this is my early 20s, I started experiencing pain in my vulva. And I went to the doctor. I went to the doctor several times. Tests were run. Everything was normal. That was great, right? Very exciting to have normal tests. But not when you're lying awake at night, night after night after night, being like, why does my vulva hurt, right? So I told my roommate about this, and she hands me a book. And the book was Sex for One by Betty Dodson. So as you can imagine by the title, the book is about self-pleasure. And this was something I had never done. This was something I had so much shame around even thinking about. And here I am now holding this book. And so I'm like trembling and shaking. And I'm like, wow, who is this roommate? And she's a friend of mine. I'm like, wow, this girl's got a lot of nerve, But I was desperate. So took the book. And that night, lying in bed with vulvar pain, I'm flipping through this book and reading some of these stories. And lo and behold, this book is full of stories of people that were experiencing a wide variety of types of pain. And they were finding that through self-pleasure, their pain was going away. So it kind of like fit my story, really perfectly. So one very, very brave night, I decided to self-pleasure for the first time. And my pain went away. I was like, oh, there is something here. So the next night, pain's back. Try it again. Pain goes away. And this happens a few times until the pain completely went away. And that was like one of those fundamental things. Sometimes in life we have these beliefs and these thoughts, and then we grow and we learn and we get more information. And it's like, well, that's an old belief that doesn't really serve me. So it was like one of those kind of like growth, like self-growth moments around that started like, I guess, making me ask different questions, such as, Well, if my body is made in the image of spirit, of energy, of God, then how could I have this body part that's shameful or bad? And if I can be healed by this, this activity, how can this activity be shameful or bad? So that was kind of my initial movement into being very curious around sex and around it as way more than just this intimate experience, and led me to coined the term that I now use a lot in my work, which is pleasure is not just about desire, but something we require. So that's story one. I have other stories for you, but I'll pause because I know I just said a mouthful.
What's interesting of what you shared, because I think I obviously, as a therapist, work a lot with not only the cultural background, religious background, but also traumas that have happened so much around sexuality. Obviously, the trauma. When I say trauma, a lot of people first only think about, child molestation or sexual abuse or rape, but that's not just the only trauma. I think that sometimes the verbal conversations that are around trauma that comes from a parent or the culture that tells us this is wrong or we shouldn't do it, or we shouldn't talk about it. I'm not even talking about having the action of that. Don't even talk about it. And one thing I've noticed a lot among couples, they'll talk about anything, but when it actually comes about wanting to talk about sexuality, the conversations are very, very surface oriented and they don't get deep. It's almost like it depends on their, it's attached to their self-esteem, very much attached to their self-esteem. And it's interesting to me because, as just, if you look at it just as a species, what the biology allows you to do, and fundamentally, yes, there's one thing that you've probably learned to do, and that's it. The rest of this is really a skill that needs to be learned, but people don't necessarily look at it as a skill to be learned. They think, I should already know it, and I should already be the best. And if I'm not the best, have it all contain as if it should have come in with the whole programming, that there's something wrong with me, versus like what you said, like, oh my God, somebody gives me a book and I have to read this, or this is shameful. Or that if I'm with my partner, I have to have all of these particular skills and get to know them, get to know my body, get to know their body. And be able to coordinate this together with some form of communication, whether it's verbal, nonverbal, or, through your body movement or whatever it is. That has been fascinating to know in this arena. Almost all human beings that I've known, with all the cultures that I've dealt with, this has been a taboo.
Oh, I mean, you wrapped up so much of the problem in a very succinct nutshell there. It is such a problem. There is such a orientation when we're talking about sex to self-protect the ego. And that orientation to self-protect the ego during conflict, it's always there, right? But with sex, at least what we see in surveys and studies, is the conversation around sex has a very heightened level of self-protection. And the moment, and this could be like evolutionary, I think, is one of the reasons, because the moment there's a sense of I'm doing it wrong, or I'm not a good lover, or I'm not providing this, or I can't make my partner orgasm, or I can't make myself orgasm, there's so much natural tendency to self-shame, right? To hide, to constrict, to say, I'm not going to talk about this. This is where we can even get into like anxious and avoidant attachment styles around, I'm going to sweep this under the rug and never talk about this ever again. Or I'm going to go into such a fear anxiety response that everything I say is going to come out wrong. And unfortunately, we're not taught how to have these conversations. Like, even medically speaking, there was one survey that showed that 69% of people that took this survey wanted to talk to their doctor about sex and wouldn't, because they were worried about what their doctor was going to think or how their doctor was going to feel. And that relationship is nowhere close to as important as their relationship with their life partner, right? Or their current lover. So when we see stuff like that, it really shows how much this conversation around sex is really pushed into the wayside. And then other surveys show us that 92% of people that have the best sex say they talk about it. So, now we know in order to have good sex, we have to talk about it. But at the same time, everybody is scared to do so. So we're really not given the foundational principles. And then if it goes, poorly, then people are responding, unfortunately, by doing this anxious or avoidant type of thing in order to self-protect. And, the evolutionary wise, like my theory, and there's other theories similar to this out there, that is because fundamentally as animals, right, as organisms, we have a fundamental like drive, evolutionary drive to reproduce. And so that there may be some sort of like evolutionary biological type of driver subconsciously to be like, oh, I have to do this. And if I'm not good at it, there's not the survival of the species. But the other big problem with this is that we're basing how we have sex on porn or on these scenes from movies where it's like, a couple hooks up in 2 seconds, their clothes are ripped off. If it's hetero, then they're penetrating each other like basically immediately. And, and everybody is like orgasming in 3 minutes and having their time of their life. And so we see that over and over and over again. So the standard of what we're trying to live up to, that's like fantasy. That's like watching Superman and thinking like, oh, we can fly, right? We would never do that. The brain knows that's fantasy and not reality, and we can appreciate the fantasy. And the same thing is when we see these hot scenes in movies, it's like that's fantasy, that it's like 3 minutes and the best orgasm of every life. It can be fun. It can be hot. We can like go there in fantasy, but we need to like start to train our brains, just like in the Marvel and DC kind of movies, that, hey, this is fantasy, that's reality, and start having these conversations and realize that, hey, if we're not orgasming because of that, we're actually normal. Like that is actually normal. And that's a lot of the work I really do, is like breaking down these taboos and help people start to understand that they are normal, that these things that are coming up in their sex life and their intimate life is actually very normal, and then helping people work through that.
I think there's also this element of, I want to separate the concept of libido versus the actual performance or the action of being together in any sort of sexuality, which is whether it's the kissing or necking or tapping or, intercourse or not. So when it comes to libido, since your name is also my libido doc, I want to go back to the libido.
Yeah, please.
There's also a biological element to the libido, and we can see it across the age. It's very clear with female of where their ups and downs of the libido are, depending on their hormones and the biological factors that are happening within their body, and different age that it actually shows up. So that's beside the point of whether they have a mate or not have a mate, or whether they're also psychological concepts that holds them back in wanting to be with their mate. And there's also this concept with men, and that you shared about the porn, and not that women don't use porn, but I've seen this more with men in my practice, where because they started looking at porn sometimes from age 10 now because of their smartphone, and becoming addicted to porn, the libido is responding more to the addiction level of it. And then on a normal level, when they go into their own relationship, it doesn't show up. The libido doesn't show up there because they're using whatever is coming up in their body within the porn. With female, what I've noticed is that there are different ages, especially around menopause, and some years after menopause, that their body has no libido. Like, then they're very frightened by it sometimes, of what happened to my life, what am I going to do with that? And even if all of the actions are there in order to activate their body, whether it's a self-pleasure or their partner is pleasuring them, that sometimes they get scared and it's like nothing. Like, you could touch me and it's as if you're touching a wood, nothing is happening. And they get really freaked out about this. And I know I said a lot in that, but I just wanted to bring a whole bigger picture of it and kind of then hand it to you and say, can you talk about this, please?
Yeah, absolutely. I want to preface by saying that I am not an expert when it comes to porn addiction. That is not my area of specialty. So, if people are having that come up, you do want to seek out somebody who truly is an expert in that. But to talk about like the low desire, the low libido, there's one of the most important things to say there is there's so many root causes, right? So it's like the most common one that comes up is low testosterone, which can affect both men and women. But the number of times that people have their testosterone fixed and it's in like not just, conventional normal, but like optimized levels. And they still have low libido. It's very, very, very common. And many times when we have optimized levels, one of the things that I've seen is that people will get this boost and where they're like, oh, all of a sudden I feel something again. But then all of a sudden, after 3 weeks, a month, it'll crash back down. Their libido will crash back down. And that's because most commonly there are many different factors. So the way I look at low libido, the way I've organized this conceptually for people is there's 3 main pillars of root causes. So we have our physical root causes, and these are anything from our hormones to our thyroid to our blood flow, our nervous system, like anything that's sending the signals to our erogenous zones that say like, hey, get in the mood. Like this is ready, kind of that responsiveness of our body. But then we also have like all the personal things. So this is like body image, this is genital image, right? It's very common. This is another problem with movies and porn is that people think that their body parts don't look right? It's not just like, weight that people are concerned with now. It's like, should I be shaved? Should I not be shaved? Like how big are my lips supposed to be? Like the vulvar lips. And these kind of things can create a lot of problems with people, for people, as well as any of that shame. But also in that personal pillar is how well do we know our body? Because the body changes throughout life, right? We know that. But what a lot of people don't think about is our turn-ons change throughout life, or even the way that our genitals respond. Sometimes the circulation system changes a little bit, the neurological system. Sometimes we get scar tissue. So like everybody will talk about, this big famous G-spot orgasm for women, but some women have scar tissue over their G-spot. Like they're not going to feel a lot there. So we want to realize that we have to be in touch with our own anatomy, and we have to understand our own anatomy ourselves to be able to ever tell our partner things like faster, slower, right, left, up, down, etc. And then the third pillar of root cause really comes back to what we were talking about early on around like the communication and how well that interplay is with our partner. Do we feel safe with asking for our needs? Do we feel safe with saying like, hey, I want to explore this new fantasy. Are you interested? Is there a way we can make it, interesting and beneficial for both of us, right? There's a lot of different things that go into it. So those are some of the main reasons for low libido. But the thing that I will regret if I don't say is probably one of the fundamental things that I see as being a mismatch for women and men is that for men, desire comes before arousal. And for women, arousal comes before desire. And this is where we can get really backwards and really screwed up on this desire mismatch conversation. So what do I mean as far as the difference between desire and arousal? Well, desires of the mind, arousals of the body. So again, men desire mind first, arousal second. Women are opposite. So to give an example, this is where in a hetero scenario, man sees the lady walk across, or in a homosexual scenario, man sees another man walk across. And all of a sudden he sees, okay, well, there's my hot and sexy partner. There's that hot person. And wow, they look yummy. And so that's like, they're thinking that on the mind, like that looks yummy. Oh yeah, I would love to play with this beautiful human, right? That's of the mind, that's desire. And then all of a sudden his genitals respond. That's arousal, right? So now he's feeling it in his body. For women, it's opposite. The arousal happens first. And so like a classic thing we see with women is they're waiting for that desire. It's not happening. And finally, they're like, okay, well, I'm just going to do this because I know I'm supposed to, and this will be good for my relationship. And they go to bed with their partner, and 15 minutes into playing, now they've like had their body touched in their stroke, and like they're starting to feel things in their body. And so that's starting to wake up their body. That's the arousal. And 15, 20 minutes in, things start to feel good. And then their brain kicks on and it's like, oh, this actually feels really good. I kind of like it. Boom, now they have the desire. And this is why so many women afterwards, when they're awake with their partner and they finish, they'll say to their partner something like, well, that was really great. Why don't we do that more often? And it's because they're waiting for the desire to kick in first, and it actually kicks in later. So when we know this and we understand that, in these long-term relationships, is very, very unusual. It's more usual that we have this desire happen at different times. So it's not about making the desire happen at the same time. It's about working with the arousal and desire cycle to help get that, like, bridge that gap so that both people actually can come to the table and want it. But it's probably never going to look in the same way most of the time, like, oh, baby, you're so hot, I want you. Oh, baby, you're so hot, I do too, right? We're wired differently.
Absolutely. Everyone, I want you to see this book, Want to Want It. And this is How to Want Sex, Have More of It, and Get Better at It by Dr. Diane Mueller. You talked about wanting to want it, and that's so, it's a great title because it is. So I think I've also worked with a lot of people which they kill the desire because of other things that are happening in the relationship. So not their body is having it, they are having dreams. Their body is having orgasm in their own dreams without them even, being aware that they get surprised. Like I didn't even think I wanted sex. And then suddenly I'm having these dreams that I'm having orgasm. And not even necessarily having a dream of having sexuality, just that their body is releasing and they get surprised by that. But you could see because they're upset, they're angry, their relationship is not going well, there's something going on, which they kill off the desire, even though their body might have the desire. Can you share a little bit about that?
Yeah, I mean, it's another example of how we have so many different factors that go into this, right? One of the things that I think can happen is like there's this capacity, right, for pleasure, and there's this invitation for pleasure. And in order to feel pleasure, we have to be present in our body. And I use eating as an example for this because most people can relate to those types of meals where it's like, oh, you have a beautiful meal in front of you and you're scrolling on your phone, you're doing 3 things at one time. And in like 3.5 minutes, you look down and you're like, oh my gosh, my food is all gone, right? There's no pleasure in eating that way. And the same thing is true, or the opposite is true when we're actually talking about eating, where it's like, oh, if I sit down and I'm going to have a pleasure meal, right? If I'm going to enjoy the pleasure of my food, what I'm going to be doing is not scrolling on the phone. Hopefully I'm hanging out with a friend, maybe talking to a friend on the phone. Or if I'm by myself, I'm going to be sitting and just like relishing in like the deliciousness and like the look and the smell of it. I'm going to be just enjoying all the flavors. Again, so that presence is about being, feeling and experiencing the thing of our 5 senses. So one of the things that can happen sometimes, and this can happen for trauma, this can happen due to busyness and overwhelm, there's so many different reasons, is that when we are starting to feel pleasure, we can find ourselves dissociating because it can be something where it's like, wow, okay, I'm starting to feel this pleasure, and all of a sudden I'm thinking about the laundry or the dishes or the list or that thing I have to do for my kids or that thing I didn't get done for work. Or maybe it reminds me of something that my partner said to me 3 weeks ago that I'm still holding on to, that I have a little trauma around that I haven't brought up, right? Any of that. So the moment we are finding that ourselves like kind of trying to engage and then doing some of what you're, talking about here around like then disengaging, that's a real big sign that there's something that is leading to us to this dissociation. So there can be a real big need for erotic repair sometimes with ourselves, as well as erotic repair with a partner, depending upon when you're dissociating. So if you're feeling this around like, wow, it's really hard to be present and experience that pleasure, a good question is that only happening with a partner? Or is that also happening with a self-pleasure activity? If it's happening only with a partner, then one of the things I feel, and this was said to me years ago by a therapist that I saw after a breakup that was revolutionary for me, which was in order to deeply heal from an interpersonal thing, it needed to happen in an interpersonal way, meaning if I'm dissociating only with my partner and not with myself, then the best way to actually heal that probably is going to involve my partner. And of course, the partner has to be willing, and there's so many other layers. And I know, you know the therapy world way more than I do, so there's so much to be said there. But to keep it simple for this, provided that everything is safe and provided that a lot of foundation is there that's positive, then we come back to say, okay, well, why am I dissociating with my partner? And sometimes an erotic repair exercise is as simple as, okay, let's put our hands on each other, oftentimes not even sexually. Let me just touch your heart. Let me touch your arm. Let me touch your leg, right? And having a partner doing that and say, can I stay connected to the sensation? Let me stroke your leg. Can I stay connected to that sensation? And we continue to push that edge into, okay, now let me try stroking your breast. Can I stay connected to that? And we get to our edge and we start to feel ourselves dissociate. Then we take a step back and we say, okay, this is where I feel safe and connected. And let me start to just experience the sensations here where I can stay in my body and practice being present. Because the moment we're popping out of our body, the moment our mind is in other places, it's going to be very difficult for us to experience pleasure because the practice of pleasure is connected to that practice of presence.
Very much. Absolutely. In sexuality, you've got to be in your body. You're absolutely right. That if you're not, there nothing is going to happen. So
exactly.
Yeah, it's very much of a kinesthetic experience. So if you're not experiencing it kinesthetically, the rest of it will not be there for you. What else is there that you really want to share that you've shared in your book that's coming out?
Yeah, one of the most important things I think from the communication standpoint is the foundation. Right. So when we're talking about sex, one of the fastest things, the quickest things that people want to do, I find, and it's just, I think human tendency is to be like, oh, this thing you're doing wrong, or this thing I want to fix. Like, I don't like it when you do that. Right. Because oftentimes that is sometimes when we start like dissociating. It's like, well, I'm bored, or I don't like that. That don't feel good. And we do need to talk to our partner about that. But when we're really building this new muscle, this new technique of communication, one of the first things is to lay that foundation where these techniques feel very safe. And, we talk in psychology, we talk in health, we talk in communication about concepts I'm sure people have heard around like, okay, our relationship bucket or our emotional bucket around like, you want to make sure that relationship bucket or that emotional bucket is high enough. So you're always like building that bucket up. So when something happens, you have some reserves in the relationship to draw upon. So the same thing's true with our sex conversation, right? We want to, especially remember, since the ego is so involved, we want to start really building somebody up and really allowing them to feel all the ways that they are doing it right, all the ways they are providing, all the ways they are awesome lovers before we start saying like, and I want you to change this. Because if we just launch into that, then people's egos can be so hurt, there can be so much withdrawal that we might not ever get anywhere. So I really encourage people when we're having these conversations initially to just start making it a practice. And it's going to probably shock your partner a little bit if you haven't been doing this. It's very normal to be like, wow, like I never heard this before. But just start really small with these words of affirmation, these words of encouragement, and be very specific. So if you are having active sex, then I encourage you to think of something recently that happened, very, very specific. I loved when you kissed me there. I love when your hand was there. I love this position and the way you held me. I love what you said. Whatever it is that you love, and be very, very specific and start naming these things to your partner in ways that like, wow, that was so awesome. I want more of that. So what you're doing is you're starting to build them up so they're actually feeling like, wow, they're doing a great job. They're providing for you. And if you are not in a point where you're having active sex, you can still do this either by remembering, going back in time and being like, oh, I remember this, or think about something that is not sex related, something that is still intimate, right? I love the way, the length that you hugged me. I love the way your hand moved down my back. I felt so supported in that moment. And there are two different things that will happen here. One is that we will oftentimes find that when you start to say these things that you love and you get more of them, some of the things that you don't like as much sometimes just fall away because we start building these things up. And most people pay attention to this because they want to, everybody wants to, in these types of relationships, they're like, oh yeah, I'm going to do what works. I'm going to do what gives me that feedback, right? Gives me that reward. So you'll get more of that. And sometimes those things that you don't like as much will fade away. Again, usually we still have to bring a lot of them up. But it does. So that brings me to the second big point, which is when you start to do this, oftentimes then that bucket of, wow, we talked about sex and we talked about all these vulnerable things and like, oh, wow, I heard so many good things and I feel like I'm such a great lover and I'm providing all these things. The more we get that bucket up so high, when we start to bring in some of the communication and the things that is like, well, maybe we need to change this. We're not coming from a point of like deficiency. Now we're coming from a point of like excess where it's like, oh, wow, if I hear one thing I need to change, but I already know that I'm a great lover, that I've been hearing these 100 things that I'm doing well, it's so much easier for my ego to not take that same level of hit. So I would really encourage people to just start with like the positives in these conversations and spend, the next month doing that before you start to bring in some of these things that you don't like. But of course, we have to talk about those too in order to have really great sex.
One of the things that I've noticed, though, when these exercises happen, and I'm sharing it to also gain your advice about this, but
please.
It's been interesting because when the communication starts and both couples are, of course, we want to do this. I want to do this for you. And even when the communication is done beautifully and nicely and, the collaboration is there. What I've noticed is that if the expectation is that there's a teaching moment, there's a learning moment, and at the same time, it can turn into like the regular sexuality, there's regular sex experience, and it might not happen that way, and they get very disappointed. So I've tried to say, can we change and can we distinguish between some of these are going to be your learning. So, for example, today for heterosexual couples, for example, today is going to be the woman's time. So she will share what she wants and the man would practice on what she says. So it will be about her. So he's not expecting that I'm going to do this. And then I'm going to also experience. Now they might experience amazing, arousal within the time. But the reason I say this is because sometimes it becomes so mechanical at the time of learning that they lose interest. Or when a person is trying to tell their partner what to do with my body, and obviously it's hard because you're trying to bring your experience into words and your partner is not inside your body. So they have no idea. And they only rely on you telling them what it is. And then in the middle of it, almost everybody's like loses patience and they just get over it and they get frustrated. And then it's like, I don't want to do this anymore. And sometimes it's been like, okay, let's distinguish between learning and then, practicing and then enjoying, like anything else, right? Like if you're just getting on a bicycle and you're going to fall and you get up and fall, you're not going to have this experience of the beauty of riding a bicycle in the air in your face because, you're falling and you have to wait and then you have to get up again. And I've also experienced that with my couples in that way. How has your experience been with this?
It's a really important thing. And really, this is why I have my book and my online courses is because it's something that there's so many layers to this. But of course, I want to answer in our time today, like as best as I can. So a couple of things to say here. One is that when we are having these moments, like we get into these, like the way you're saying, like, oh, the kind of the monotony almost, like it's like a sexual script, right? That we get into where it's like, oh, I kiss you here, you kiss me there, I flip you here, we do this position, we do that position. Oh, we're trying to orgasm, boom, bang, we're done, right? And most couples wind up having 2 or 3 versions of this sexual script. And when you've been together 10, 20, 30, 40 years, well, even when you've been together 2 years, like when you only have 3 ways of doing something, it's going to get a little boring. And The other thing, though, that's important to understand with that is that when we have these sexual scripts, it is because, in part, our neurological system is like kind of like we drive to a grocery store and we drive to the gym, and maybe there's two routes and we always take the same one. So it's kind of like that. Our neurological system gets into this like program where it's like, I do this. And we do that, evolutionary speaking, because we can only make so many decisions in a day. It puts us into this place where we can still accomplish a lot and we don't have to like micro decide on everything. So it's natural, it's normal. But because of this, when we're in a script, it's like there's a huge amount of habit that we have. So just because we have a conversation, it's like, oh, I love that thing. Some people, I find some couples are, they do grasp it right away and they do bring it in. And a lot of couples, like you bring up, are like, wow, I'm not following that change right away. And so I do think it's a really important thing to also have a conversation. And it's such a good question you bring up around, well, what happens? What is our agreement going to be when and if I forget to do more of that, right? So we want to, anytime we're having these conversations, to have a sense of how are we going to handle this if I say this and it doesn't go wrong? And how can I re-bring it up without hurting your ego and shaming you, and also without me feeling disappointed? And of course, we want to, accept that as humans, we're going to feel sometimes disappointed. And, that's a different kind of conversation around how to deal with all of the human emotions. But some of this is actually realizing that any time that we are over patterning that neurological system, it really is like driving to the store. So it's like maybe we have that, we're like, oh, I'm going to start taking this different route. Well, maybe we have a sticky note in our car. Maybe we have like some other trigger that's going to tell our mind like, oh, even though you've done this the same way 1,000 times, we're going to redo this, and we have our cue. So we want to actually start to have that conversation around and just know that we're going to go into this. And for many people, this is going to take a few, sometimes 10, 20, 30, 40, 50, times of saying like, great job. I love that. And remember that thing? Remember that thing I mentioned? Remember, I love that so much. Can you bring that up? And go into this more as like, how are we working together? And know that, hey, if our partner loves us and they're like want to provide for us and pleasure, they will get this. But it is probably because it's not anything, we make up these stories around like it means that they don't listen or they don't care. Well, most of the time it just means that they've done something 1,000 times one way. And so their neurological system's already on that program, and we have to rewire that neurological system to do something different. But then, like I said, that other type of thing that can really help in these conversations is to also, before we have these conversations, to even say like, okay, well, we start having sex and I mentioned something I want to try and you forget to try it. How do we have a follow-up conversation where I can bring it up and I can still feel like I can bring it up safely, and you feel like, hey, I'm not just like annoying you or something like that. So we do want to have sometimes those, what if this goes wrong? How do we have that? If we pre-plan that in advance around like, hey, if you say it to me this way, that will help. Or, sometimes another thing that I've done with my partner is that if like we have a plan where it's like, if he's not getting it, what he's told me to do is like take his hand or take whatever, body part I need to manipulate or do something to move him. And he's given me permission to just like do it in real time. But I've asked him, how in real time do you want me to do this in a way that makes you feel like, hey, I'm being supported? And he's given me the information around like, if you do it this way, this would help me.
Absolutely. I think it's such a fine line because we're, each person not only are concentrating on the other person's body, but they have to be within their own body in order to experience it. So it's such a delicate balance of being both in your body and to your partner and creating this dance together. And again, sometimes it's just saying that, today, I want to learn that today I'm going to make it about you. I'm not going to have an expectation. I'm not going to be in my own body necessarily and have an expectation that I'm going to have the orgasm. But I'm going to hold the space to be with you and pleasure you, and then be in the pleasure of learning about you. And then as you practice and get it right, then it will flow in from that perspective. Okay, everyone, go ahead and get this book, Want to Want It. How to Want Sex, Have More of It, and Get Better at It by Dr. Diane Mueller. Diane, anything we haven't said that you really want people to know?
Just to be clear on that, just to get Want to Want It, it's super easy. You just go to wanttowantIt.com. So just to make sure that people know how to get it. So wanted to say that. And other than that, I think, just to add on to something you said there at the end, like another part of erotic repair that I've seen that can really help some couples is doing almost like exactly what you said around like taking turns, where it's like, okay, one session, it is one partner's like the goal is for that partner to just not worry about their own pleasure so much and just learn about their partner and give. And you switch roles and you can go into this ahead of time to say, okay, well, tonight, honey, it's all about you. And then next time it's all about me. And then that allows you to also, like you said, like get out of like that point of trying to get all the information and feel all the information at the same time, especially when we're learning. So I just wanted to, tag on what you said there, because I do think it is a really important thing. And then the final thing I'll leave everybody with is be okay as you're like learning this and you're bringing in new habits, and like be okay with messing up. Be okay if it's awkward. Be okay with not getting it right. Like, sometimes people ask me like how to avoid awkward sex. And my response to that is you're not asking the right question. The question is how to be okay with sex and to laugh about it and be silly and playful and loving, even when it is awkward. Because the more we try these things and the more we bring in the conversation and the more we bring in novelty, like, it's almost like dating each other again. There's going to be moments where it's like, wow, that was a swing and a miss, right? And so just being okay with that. And the more you can bring in playfulness and silliness and laugh when it's awkward, the more the awkwardness will actually make you closer together instead of being this thing that you have to avoid.
Absolutely. Where can people find you?
So obviously wanttowantIt.com, but then please also go to my Libido doc, and I'll actually give everybody a free gift too. So a really fun way of bringing novelty back into your life is to take my yes, no, maybe checklist, where you can actually go through with your partner to say, hey, are you interested in this? Are you interested in this? So if you download that checklist, it's a really fun activity to do with your partner to also just start the conversation of like, hey, we haven't talked about sex before. Let's go take this checklist and let's just see, what's interesting to you. So if you want my free checklist, and it has ideas in there, not just about sex, but about emotional intimacy, fun date nights, all sorts of different things. So you can download that for free at mysexdoc.com.
mysexdoc.com. Beautiful. Thank you so much for taking the time and being with us.
Oh, thank you so much for having me here. It's such an important conversation. I really appreciate you including me on it.
Well, absolutely. And for all of you who are out there, if you love this conversation we have, please share it and give us a rating and create an amazing life for yourself, for your partner, for everyone around you. And until next week, bye-bye.
Introducing a powerful new update from the Foojan app. Now with flexible subscription plans to fit your journey monthly, quarterly, or yearly. Our new AI-driven onboarding customizes your path to feeling better, faster, and enjoy a refreshed experience with stunning 3D interactive videos. Update now. Empower your inner voice with Foojan. Download today.
Welcome to The Inner Voice, a Heartfelt chat podcast. I'm your host, Dr. Foojan Zain, a psychotherapist and author and the founder of the International Awareness Integration Institute. Today, I will be having a very, very hot and educational conversation with Dr. Diane Mueller. She's a seasoned sexual wellness authority, blending a strong educational foundation with a rich clinical and teaching experience. With a dual doctorate in neuropathic medicine and acupuncture and oriental medicine, Diane has illuminated the discourse on sexual health through her practice. My Libido doc. This is her practice, My Libido Doc. Her personal journey through sexual health challenges and equipped her with a unique empathic lens, enriching her holistic approach to patient care. Diane extends her expertise through the Libido Lounge podcast and her online training institute, and by training medical professionals worldwide in functional medicine. Her proactive community engagements include co-hosting sexual health events and participating in numerous summits, reflecting her commitment to fostering well-informed sexual wellness dialogue. At the heart of her practice lies the belief that healthy libido is a cornerstone to holistic wellness, driving a practice that has orchestrated transformative health journeys for her clients. And we will be actually talking about her latest book, Want to Want It, wanting more sex, and talking about the experience of what goes on inside of you, how you could communicate with your partner, how you could take care of your body, how to be in your body, stay in your body for one of the most amazing and pleasurable essence of your life. So I'm sure you'll enjoy this conversation, and a lot of great key points in this conversation. Now, be sure to subscribe to my podcast on my YouTube channel. Connect with me through my website, FoojanandDr.com, or any of my social media. Go get the Foojan app from Apple Store or Google, and go through 31 areas of your life, including your partnerships, including your sexuality, and meet Mira, which is an AI chatbot, which will answer your questions. Now, share your thoughts with me at any time. I'd love to hear from you. And without further ado, here's Dr. Diane Mueller.
Listen up if you want to promote your personal growth and self-awareness. I found the Foojan app last month and I have been absolutely loving it. I personally have never learned guided meditation, but thanks to this app, I now have learned incredible tools for my own stress relief and emotional self-awareness. Not to mention, there are self-evaluation tools and professional coaching available to utilize however your journey to self-discovery takes you. Join Foojan today and redefine your life one step at a time.
Intentional Parenting, a practical guide to awareness integration theory, written by Dr. Jafari, Dr. Foojan Zain, and Dr. Manoukian, 3 experts in human development, is your step-by-step guide to raising a healthy child prepared for a culturally integrated world. You're supported in parenting infants to adolescents using the latest evidence-based scientific research on parenting. Order your copy on Amazon now.
One of the fundamental things that I see as being a mismatch for women and men is that for men, desire comes before arousal. And for women, arousal comes before desire. And this is where we can get really backwards and really screwed up on this desire mismatch conversation. So what do I mean as far as the difference between desire and arousal? Well, desire is of the mind, arousal is of the body. So again, men desire mind first, arousal second. Women are.
Are you a psychotherapist looking to enhance your practice? The Awareness Integration Therapy developed by Dr. Foojan Zain is a comprehensive guide to the principle and techniques of this powerful therapeutic approach. Join the growing community who have elevated their practice and expanded their skills by embracing Awareness Integration Therapy and witnessing its life-changing impact. Order your copy on Amazon now.
When I join Anabasis Academy, what do I get and what I don't get?
What do you get? What don't you get? You don't get a certificate because certificates never guarantee prosperity. You don't get generic so-called practical advice and recipes because you're unique and they hardly ever work. You don't get a bunch of shallow motivational nonsense because the only one who can motivate you is you. You will. You will get provoked and you will get fresh perspectives to consider. You'll get to activate your mindfulness, to tool up and move up, to discover your talents and gain confidence. And like all other remarkable people, if you engage and act, you will get a uniquely yours opportunity to evolve and shape your future.
Visit AnnaBazesAcademy.org. Explore the difference, experience it, and make a difference.